Welcome back to Docshala. So today our topic of discussion is limiting structures of mandibular denture. So now look into a question from Dental Dex. So the question is the primary reasons for obtaining the most extensive aerial coverage for mandibular denture are. So what are the primary reasons for obtaining a most extensive aerial coverage for mandibular denture? So the options given are to increase the capacity of underlying structures to withstand stress due to biting force and to improve appearance. Is it to provide balanced occlusion or to increase tongue space? Is it to increase the capacity of underlying structures to withstand stress due to biting force and to increase the effectiveness of seal? So what is the difference between these two options is, first option is telling that is it to improve appearance, and the third option is telling that is it to increase the effectiveness of seal, and the fourth option is it to improve retention and to increase the tongue space. Okay, so if we just look into the options here, they are a bit confusing and a bit large also, so just don't get confused with that. Just break that options into parts so that you can easily understand what he is asking for. So what he is asking, what are the primary reasons to obtain the most extensive aerial coverage? The aerial coverage is nothing but the denture coverage which we make so that we get a proper denture which will help in remitting the rocking of the denture. Okay, so what is the primary reasons we do that? So primary reasons to prevent the rocking of denture is it to increase capacity of underlying structure to withstand stress due to biting force. So this is one part. So this part is repeating in the third option also. Okay, the third only thing that is differing in between these two is it to improve appearance or is it to increase the effectiveness of seal? Okay, and the second thing is it to increase tongue space? So this is repeating in second and fourth options, and it is just differing whether it is to provide balance occlusion or is it to provide retention. Okay, so this is how you just understand what he is asking, right? By understanding what he is asking, you can easily derive what the answer should be. Okay, so let us just move on and see what are the limiting structures of the mandibular denture that we have. Okay, so this is the mandibular denture. So this is the anterior labial area, right? So the mandibular anterior labial area, the action of mentalis muscle and the mucobuccal fold in this area determine the extension of denture flange. Okay, so the main muscles which help in determining the extension of mandibular denture in the labial area are mentalis muscle and mucobuccal fold. Okay, then labial frenum. So the labial frenum is, this is the labial frenum, right? So it helps in attaching the orbicularis oris muscle. So the size of this structure limits the extension of the denture border. We know that we relieve the labial frenum. So you can see that here, right? So we are relieving the labial frenum. So what will it help in determining? The structure limits the extension of denture border and also thickness of denture base and affects position of mandibular teeth. Okay. Then coming to buccal vestibule. So this is the buccal vestibule. As you know, it is influenced by the buccinator muscle, which has fixed muscle fibers running in oblique direction and therefore have little displacing action. The proper extension in this area provides best support for the mandibular denture, and this area is referred to as buccal shelf area. Okay. Then coming to the masseter area. So this is the masseter area. It limits the denture in the lateral direction by the action of masseter muscle. Okay. Then coming to retromolar pad. So this is the retromolar pad. It marks the distal extension of the denture and it is covered for support and retention. Right, then coming to lingual frenum. So the lingual frenum, this is the lingual frenum. It should be established with the movements of tongue, genioglossus muscle, and it influences the length of flange during normal movements of the tongue. Okay. Then coming to sublingual gland area. So this is the sublingual gland. You can appreciate that here, right? So this sublingual gland area, maximum extension is desired without overextension. So we should not overextend into the sublingual salivary gland area, because if we impinge on sublingual salivary gland area, what happens is the gland will get disturbed, and that will not help in proper retention of the denture, because there is a chance of necrosis of the area also. Okay, then coming to the mylohyoid area. So you all know this is the mylohyoid area, right? So this is the mylohyoid area. So the mylohyoid area, flange in this area must accommodate the movement of the mylohyoid muscle while swallowing, right? Then coming to retromylohyoid area, it is just backward to that of the mylohyoid area. So it is limited posteriorly by the action of palatoglossus muscle and inferiorly by the action of superior constructor, lingual slip of the superior constructor. If these muscles are impinged upon, the patient may develop a sore throat. Okay, so we should keep that in mind while preparing the denture, right? So from this we have understood how we limit the denture borders in the mandible and what all we need to keep in mind. So let us just go with the key points that we should remember. So the under extension of the mandibular denture. So under extension is that without proper extension into the spaces, right? The mandibular denture results in decreased tissue bearing surface affecting the denture stability. Okay, so under extension should not be done, because it will result in decreased tissue bearing surface and affecting the denture stability, right? Then marked ridge resorption is observed if the denture terminates short of retromolar pad. So we should always remember to cover this retromolar pad properly, otherwise this will result in marked ridged resorption. Okay, and the underlying basal bone underneath the retromolar pad is resistant to resorption. Okay, covering these will provide some peripheral seal. So an overload of mucosa will occur if bases covering this area are too small. Okay, that is why we need to cover the underlying basal bone near the retromolar pad region properly to avoid marked ridge resorption and an overload of mucosa. Okay, then coming to the points which we need to remember for life. Okay, even if it is for the exam, for clinical practice, whatever it is, we need to remember these points for life. What are the points? The mandibular denture does not rely on suction. Okay, we need to remember that mandibular denture does not rely on suction. So hence, since we have a suction effect in the maxillary denture, the provision of seal, like it will get sealed into the ridge without much effort. But since we don't have this suction effect in the mandibular denture, the denture will not get sealed that easily. Okay, so how to provide this effect, like not like suction effect, but how to achieve this denture stability is cover as much as basal bone you can with the denture. Okay, so that will help in increasing the stability of the mandibular denture. But remember, we should not impinge on any of the muscles. Okay. Then the active border molding performed by lips, cheeks, tongue determines the peripheral areas of arch, establishing maximal bone coverage. So the active border molding is the important step which we perform during the mandibular denture making. Okay, then so coming back to our question, so as we have seen the limiting structures of the mandibular denture, right? So the main primary reason is it will help in why we use this maximal coverage area. As we have seen, why it will help in increasing the denture stability, right? So one thing is it will help in increasing the denture stability. How? By providing maximal peripheral seal. So maximal peripheral seal. So so in these options we find that this third option is there, which is telling that it increases the effectiveness of seal, right? And it also increases the capacity of underlying structure to withstand stress due to biting force. That is obvious, right? When we have a maximal coverage area of the basal bone, it will obviously increase the area of the capacity of the structures to withstand stress, right? So from this we can derive that the answer for the question is option C. It is to increase the capacity of underlying structures to withstand stress due to binding force, and also to increase the effectiveness of seal. Okay, so these are the reasons for which we thrive in obtaining a most extensive coverage of mandibular denture. Okay, so I hope you got the concept behind this, and I hope you understood the concept behind this. It is really very simple. Okay, you can easily mark the answer without even knowing the concept also, right? Since how you can easily see, right, when why we are extensively providing the area, like extensively covering the basal bone, is that simple. It is just to withstand stress. That is okay. And extensively covering, will also provide good seal, right? Good seal of the denture, thus which will help in preventing the rocking of the denture. So it is really easy to achieve this answer. So we should just keep our mind logically so that we can get to this answer. Okay, I hope you have understood. See you again in the next session. So if you like our video, do subscribe to our channel, and you can also follow us on our Instagram handles at Docshala for dental content and Docshala Medical for medical content. You can also find us on Telegram. Thank you.